Now, time now for something we've been doing every Saturday, answering your questions about COVID-19. For that, we're joined, as we always are, CBC News medical contributor, Dr. Peter Lynn. Good morning, Peter. Good to see you, as always.
Good to see you, John.
Before we get to our audience questions, I want to ask you about something we heard from Dr. Anthony Fauci yesterday on Capitol Hill about vaccines. Let's have a listen.
We hope that as the time we get into the late fall and early winter, we will have, in fact, a vaccine that we can say would be safe and effective. One can never guarantee the safety or effectiveness unless you do the trial, but we are cautiously optimistic that this will be successful.
Late fall, early winter, safe and effective. Does that mean potentially a tested, ready to go, ready to distribute vaccine that might be the light at the end of the tunnel? What do you think, Dr. Lynn?
Yeah, he was very cautious in choosing his words. So he's saying that it's tested, which means the phase 3 study. That's the one that we've talked about before. 30,000 people, half of them get the vaccine, half of them don't. And they've started that already this week. So many of the vaccines, maybe 2 or 3 of them, have gone into this phase 3 study. All the vaccines right now need 2 shots. So therefore, they'll need another shot towards the middle or the end of August. And then after that, they're going to collect data. They're hoping that the people that get vaccinated, they don't get the infection. And the people that did not get the proper vaccine, they got the placebo one, would get infection. And if we could show a big difference between the two, then they can stop the study as soon as they can show that the thing is working. They'll continue to collect a lot of safety data, but you can imagine in countries where there's lots of viruses, this collection of information may be quite quick. So in other words, if there's lots of virus around and we see a big difference between the two groups, then we could stop the study, but the safety data will be fairly short, right? The most that we're going to get is maybe between now and the end of the fall season. And then we'll have a tested vaccine that can be approved. They will continue to monitor these people long-term to look for long-term side effects, of course, but then we'll have a vaccine that can be produced and perhaps approved in different countries. Now, the problem is that the governments have to approve it, and then you can get the vaccine. And then we get into the problems of manufacturing, is that we need a lot of vaccine. If you need 2 shots, you need to double the amount. And perhaps only the countries that are the worst hit might be ethically the ones that get it first. So in other words, places like India, Brazil, United States, where the numbers are huge, they would probably need the vaccine much more than we would, where we've done a good job controlling the virus. So I'm not sure how fast it'll come to Canada, but certainly the hope is that we'll have proven that these vaccines work. And then finally, even if it does come to Canada, who should get it first? Probably the vulnerable, the healthcare workers, the frontline people. So there may be a little priority list as we go down. So if you're in a low-risk category, you might not see the vaccine for some time. And that's why we still have to practice all that social distancing and all those good things that we've been doing for the moment until the vaccine comes here to Canada. Okay, we will watch this space as far as the vaccine goes. But we do know that this week, announcements from particularly the province of Ontario about return to school. We've heard other provinces do it as well. So we're getting a lot of questions from our viewers about that. Norbert Engel says this: I'm a 61-year-old substitute teacher with type 2 diabetes. How concerned should I be about returning to work when the schools reopen in the fall? What do you make of that? Yeah, that's a lot of concern. So the person with diabetes, either type 1 or type 2, are not more likely to get the virus, but if they get the virus, they're more likely to have the complicated version. So for example, if you looked at death rates, somebody without diabetes, the original data around 1% death rates, and in terms of diabetes, about 7%, so about 7 times higher. So that's why we want to take all the precautions. And so that's why we need some details of these openings. You know, how are the teachers going to be protected? For that particular teacher, if they're going back in, I would say mask as well as a face shield. And that way we've got the most amount of protection that we have. And if they're further away from the student, I know a lot of teachers are saying, but they can't see my mouth and expressions. Then if you're further away from the students, then maybe the mask can come off, but maybe the face shield might not be a bad idea, so people can still see your expressions and you can still, engage with the students. And so therefore, protecting the teachers are as important as protecting the kids. Because we know that for children with medical conditions, the recommendation is to keep them on the online system and not bring them in. But for the teachers, the information is a little bit more sketchy as to whether we should be protecting the teachers that way as well. Okay, next question is from Laura Robertson. She says, I'm a high school teacher returning full-time to in-person classes in September. My bubble will expand from a few people
as it has been for months, to over 100 in a day. Would it be safe for me to see my high-risk senior mom?
Yeah, that's a good question. So all of a sudden your bubble has expanded and we don't know what their contacts is in terms of the kids. So you have to do all the things that you protect yourself normally with. So masks, face shields, washing your hands, you have to do all of those things. And then in terms of visiting elderly parents or grandparents, what should we do? I think in the beginning, we need to really keep that distance apart still. Okay, so in other words, the 6 feet. So even though they're technically speaking part of your 10 people bubble, because your bubble has expanded dramatically, we don't want to bring accidentally the virus to them. So keep that 6 feet apart. The mask will still be on there. If you want to do a hug, and we've talked about this before, if you're going in for the hug, both of you hold your breath. So your parents hold your breath, you hold your breath, so the virus is not moving at that moment. And so therefore you can get a hug in there. And so same thing with grandparents, grandkids want to give them a hug. So as the grandkids are coming in, I tell my elderly grandparents, I go, you hold your breath for that last 3 or 5 seconds, and they come in, they're breathing behind you now, and you could breathe. And then once the hug is over, as they're pulling away, hold your breath again, and then that way the virus can't be breathed into your system. So these are simple things that we can do, but definitely in the beginning, we want you to protect yourself and also protect the elderly and the vulnerable around you as well.
Dr. Lin, we've only got about 30 seconds left, but one final question here from Monica. She says, I have a friend who has recovered from COVID-19. Can I get the virus from them?
Yeah, so in the beginning, we said once they get it, they're done. They're immune and things like that, don't worry. But now we're finding out that they continue to shed virus in some people. Like when they're looking at samples, they're still finding some viral particles there. And when they're sampling stool, they can actually find it there for, let's say, 20 or 30 days. And there have been some people that shed viruses for, let's say, 100 days out. So that's why if they've had it, I would still say take precautions in terms of the 6 feet apart, the masks, and so on and so forth, because there is a concern that is there a healthy carrier status? In other words, some people just carry the virus with them, and so therefore they can still multiply the virus and still pass it on. So let's just take that distance and keep those simple things in place to protect yourself as well.
A lot to remember. Thanks for helping us do it, Doctor.
Thanks, John.
CBC News medical contributor, Dr. Peter Lin.